Hi, my name is Parag Patel, and I'm a second-year medical student at Nova Southeastern University. This presentation is on the modeling of adverse ventilatory effects of nasogastric catheters in neonates. Nasogastric catheters have a variety of indications, from feeding to gastric lavage, and are used in a variety of acute care settings. Neonates have a restricted upper airway anatomy, and therefore there is a risk of upper airway obstruction with the insertion of nasogastric catheters. It's been reported that nasogastric feeding can reduce minute ventilation, tidal volume, and oxygen saturation in neonates. However, a quantitative comparison of different types of nasogastric catheters and their effects on airway resistance has yet to be performed, and this was the aim of the current study. To achieve this, an MRI of a 37-week neonate was used to 3D print a 1:1 scale upper airway model, as seen in Figure A and Figure B. Figure A shows the internal geometry of the upper airway, and Figure B shows the external view of the test configuration, with the airway model, nasogastric tubes inserted, as well as the various sensors. 5 different test configurations were applied, starting with the baseline in which no catheters were placed, single or dual 6 French nasogastric catheters, or single or dual 8 French catheters. With the dual catheter configurations, one nasogastric catheter was placed into each nostril. Medical air was then passed through the model at progressively increasing flow rates, and the flow rate as well as the pressure at the laryngopharynx were measured. The pressure flow graph was then subjected to linear regression analysis to calculate the total airway resistance for each nasogastric catheter. The results indicated that all nasogastric catheters tested increased the airway resistance in a measurable way. However, the dual 8 French catheter produced the greatest increase in airway resistance by a disproportionate amount, namely 3.01 centimeters of water per liter per minute of an increase in airway resistance relative to baseline, and this represented a Z-score of positive 651, or a 78% relative increase in the airway resistance relative to the baseline. Figure C summarizes the data, showing the total airway resistance for each of the test configurations. The conclusions of this study indicate, firstly, that nasogastric catheterization measurably increases the airway resistance, and that this increase varies considerably with the number and type of nasogastric catheters, as well as the configurations that they are placed in. The relationship between catheter size and airway resistance is not linear, and some catheter configurations, for example the dual 8 French catheters, produce a disproportionate airway obstruction with resulting increase in the airway resistance. These findings may help explain some of the ventilatory effects that have been noted in neonatal clinical studies with nasogastric catheters. And at the same time, these studies may also provide some guidance in terms of proper and more safe selection of nasogastric catheters and the sizing of nasogastric catheters in a neonatal population. Future translation of this work into a predictive software rather than a bench-based model can permit for a rapid, bedside selection of individualized nasogastric catheters that are optimized to patient characteristics and maximize patient safety by minimizing the risk of airway obstruction. Thank you for listening.